Hi everyone, welcome to my channel. This is Nurse Ify again coming to you. Um, if you have not subscribed, please subscribe and hit the notification button so when next I upload, you will get notification um, that I uploaded. Well, today I am going to be talking about a typical day for a as a clinical nurse instructor. So, as a clinical nurse instructor, what you do is that you take the students to the clinical site, either the hospital or the nursing home or clinic, wherever they go. So, the what you do, you get there. My day usually starts early. So get there like 6 o'clock, do the assignment, and wait for the students to come in. They usually come in like um, 6:30 is the time that they're expected to be there. Anything after 6:30 is considered late, and we are very strict about that. So they have to come in 6:30, sign in, get ready, and properly dressed with all the material they need, their paperwork, their stethoscopes, scissors, pen, and papers. So we are usually very strict about that. So I assign these students to the patient or the residents that they have to take care of, and then they go and do their assessments and do everything they need to do. Um, if they have a question, they come and get me. And before that, before going to the floor, we usually have what is called a pre-conference. Pre-conference, I tell them what I expect for the day, um, when the break time is going to be, what paper is expected, at what time is expected. Um, and then ask them one or two questions. Sometimes I quiz them in medication and all that, like the side effects, the antidotes, and um, or physical assessment. Then while they are do after that, they go to their patient, and then while they are doing the assessment, I walk around and check on what they are doing, see if they are doing it right. If there's anything I need to correct or teach, then I go ahead and do that. And then at 9 o'clock, we usually assemble again and take a break and for 30 minutes break in the morning. Then we come back at 9:30, and then our day continues. We do it over and over again. 12 o'clock, usually, most times I like to pass med with them. And so that way they can get a feel of being a nurse or how to pass med. And while they are passing med, I want them to tell me, what does the medication do? What will you monitor? Like, you're giving a blood pressure medication, I'll ask them, what do you monitor with this patient? Oh, blood pressure. I say, okay, check if the blood pressure is less than 60, will you give it? So I want to hear them say yes or no. I want to make sure they really understand what the medication is doing, because being a nurse is not just giving those medication, but you really have to know what the medication do. So, and that's what I want to instigate into them. I want them to start getting used to it, getting used to knowing what the medication do, because there are so many medication out there, and like some of them are so we're afraid. I always kind of assure them that it gets easier the more you do it, the more you do it. It's just like repetition. Repetition makes it better or makes it easier. So you begin to get used to what it's doing, what to expect in the medication. So then at 12 o'clock we take our lunch, and we after the lunch we come back again, check on our patients. We do everything that is needed in the floor. We want to do the tube feeding, we want to do the wound, we want to do the colostomy bag, we want to do everything that is needed. But while they are doing these things, a licensed nurse, which is me or either the nurse that is assigned to that patient that works for the facility, have to be around them to make sure they are monitored while they are doing it and they are doing it right, because they are not licensed yet. So they are actually working on my license, being their instructor. So I always want to make sure that they are doing it right, because whatever happens, anything that goes wrong, I should be held responsible, because I am the instructor. So that is the day in the life of a clinical nurse. Then usually at 2:30 we get out the floor, we do our little post conference. In the post conference, we are usually want them to tell me what they learned today, what's the new medication they saw today, does the medication do, and all that stuff. So or if there's any other procedure that is done, maybe surgery, bleeding stuff, colostomy, if anything that they learn. So we go over it, and while they're telling me, I kind of ask questions and try and expect them to answer. And some of those questions is just trying to cross check to know what they learn, and also for me to teach more and see where they are deficient. So, and our post conference usually lasts for sometimes an hour, 30, and or sometimes 30 minutes. And then we leave like 3:30. Um, and that's usually how this is done. Okay. And the first time you are a clinical nurse instructor, you will have to follow somebody. Like when I started this, I had to follow somebody for 2 days, and then I was left by myself to do it. So the first time you get in there, you'll be asked to go with somebody. So on the days that I'm not in the clinical, some days I think once in a week I go to the school. Then I had to teach the skill labs, but it's not all the time. Some days I'm required to do that, depending on what they need help with in the school. All right. Thank you guys for listening. I just want to make this video very short. Make sure you subscribe. Don't just keep watching me without subscribing. Thank you for those that have subscribed, and I will see you again on my next video. Bye.